I don't think that our patients expect us to be their friends. They don't need us to empathize with them on the same level that we would empathize with a friend, to be able to say, I feel your pain in any meaningful way, or I know exactly how you feel. I think it's important to be sensitive to the words you use to show that empathy. In other words, I wouldn't say, I know exactly how you feel, unless you can give them some reason to make them think that you do know exactly how they feel. But short of that, I think that patients are just genuinely happy when you can listen to them.
I find with like the EMR, for example, we're all taught to get our notes in, and we're sitting there clicking on the keyboard and trying to get all of the information that we're asking patients. And it's helpful to actually remove yourself from that just for some part of the visit and try to relate to the person as a human being. One human being to another, with all their faults and weaknesses and all your faults and weaknesses, right? Because none of us are perfect. And I think that actually helps to establish trust.
If it's somebody that you know, I think it's very appropriate to just be genuine with your patients. If you're feeling like a story that they just told you makes you sad, say, wow, that must have been really hard, or I feel really sad hearing that. How does that make you feel? I think the most important thing is just to keep the focus on the patient, and help them to know that you're there. You're sharing your experience of sadness or whatever emotion you have as a way of connecting with them and keeping the focus on them. You never want to put yourself in a position of having a patient comfort you or feeling like they have to tend to your emotional needs.
Part of that also comes with experience. The more patients you see, the more normal things seem to become. It's like, okay, at first, if you're first starting in practice, and it might be shocking, some of the behaviors that patients are doing in terms of like high-risk sexual behaviors or drug use or, any of the other myriad things that we encounter. But as time goes on, you realize, okay, this is, just part of, daily life for people. And then it's easier and easier to become more non-judgmental about that as time goes on, and also to have more empathy with perspective and time.
Sometimes we feel that separation a lot in the hard moments, but I think that a way to make that a little bit easier is actually to also share some of the positive moments with patients. So when a patient is very excited about something, that's something to celebrate with them. If you have a patient who is in 5th grade and just made the honor roll, give them a high five, show them that you're proud of them. That's a way of building that rapport so that you have the ability to enter into some of the harder things with them.